Ladies and gentlemen, a warm welcome to this first edition of Operation Health, an event myself and my AHIMA colleagues have been looking forward to for a very long time. Supported by our very influential strategic partner, the Council of Cooperative Health Insurance, the CCHI, and our co-organizer, AHIMA. The goal of this event is to deliver solution-driven, relevant, and actionable content from global leaders with a focus on 4 key areas. First and foremost, we want to improve patient quality and safety. Secondly, we want to improve the quality of your health information and use it in a meaningful and impactful way. We want to guide you in how to train and scale up a medical coder workforce and introduce you to leading educational resources, organizations, and companies in medical coding, CDI, RCM, and how also to manage cyber threats. And last but not least, we want to introduce you to one of the most cutting-edge telehealth solutions worldwide. All these sessions will be available to download after the event, and there are also a number of workshops available on the Operation Health website on the topics I just mentioned. These can provide you with an even more in-depth skills and knowledge in one or several of these important topics. We know that many of you today are facing tough challenges to deliver the best possible healthcare and outcomes for your patients. We guarantee that by the end of today, you will be better equipped to tackle these challenges. I want you to know that AHIMA is committed to be your partner in delivering the best possible care for your patients and citizens. On that note, then it is an honor for me to introduce our opening keynote speaker of today, Dr. Shabab Alghamdi, the Secretary General of the Council of Cooperative Health Insurance, also known as the CCHI in KSA. And please forgive my terrible Arabic pronunciation. Dr. Shabab is an internationally well-known visionary leader when it comes to improving healthcare. Dr. Shabab has worked tirelessly to accomplish a regulatory environment that enables stakeholders to promote transparent, equitable, value-based care. Dr. Shabab is a Canadian certified family physician with broad experience in clinical practice, managing physicians' performance, change management, quality assurance activities, care management, value-based healthcare, and medical contracting proficiency. It's my great honor to please welcome Dr. Shabab Alhamdi.
Thank you very much. It gave me a great pleasure to be with you today. And definitely this is part of our role and responsibility to reach out to our partner on this journey. And I would believe AHIMA and other similar associations in the country or international is one of our strategic partners that promote better activity in their field of expertise. That's why we have a vast interest to continue our partnership with you and to share our progress on regular basis to make sure we align and we synergize together. As such, I would like to share with the audience today on behalf of CCHI several thoughts and projects and activity, so we can really see where is CCHI and how can we move toward the journey together. So we'll just shed some light on our role and responsibility. I'm sure most of you know our role and responsibilities. However, I think it's good to just refresh your memories, and also we'll talk a bit about our performance. In addition, we'll share with you and refresh about our strategy and how we do envision value-based and how is this connected to what you are doing in terms of coding and billing standards. And finally, we're going to share with you our mega project, which is NAFIS, National Platform Health Information Exchange Services, which is the national single platform where we mandated to build it across the whole country to have a two major element, which is the insurance services and the clinical services. So our role is really to make sure our benefits package or our essential benefit package to our population, who's around 11 million, and we expect them to increase by 2030 to 20 million regular in the country and more than 40 million in terms of visitors. Also, our role is to enforce the coverage, and also we have a call center where we provide a support for more than 500,000 calls per year. In addition, we also protect and ensure health information privacy are well protected as by the country law and regulation. We watch the market and we make sure there is enough competition, mature competition in the market, and we build the capability toward that direction. In addition, also we work on improving the qualification and classification of provider and buyer to help them to build their capability to deliver value-based healthcare. So we have more than 13.2 million now, 11 million in the country. 2.2 are traveler visitors, Umrah, and tourists. We provide for them emergency medical coverage. We have a huge number of insurance companies, 560,000 employers, more than 5,000 providers of all types, in addition to 7 TBAs. And we started recently to accredit qualified revenue cycle management. We know very well we need really to work hard on the provider side to improve their CDI, to improve their systems, and to improve their revenue cycle in general. So we thought bringing talented company who can provide these services to provider is very important. These are the projection of the market size. We are expecting to triple over the upcoming 10 years, which is a huge opportunity for the sector. In addition, we are also constitute a good size of the market. We are 58% of the total market of insurance. These are the distribution of our insurance patients. And this is our cost in comparison to other countries. And we are very, very efficient when we compare our cost per individual per year. So during 2019, I'd like to thank our partner in all sectors who has helped us to craft our strategy. And after seeing the benchmark, we came and seeing also the macroeconomics for the kingdom, in addition to our national transformation program and the health program transformation, in addition to the global change in terms of healthcare development, value-based, we came up with our strategy that it is focused around beneficiaries. It's focused around the employer. Beneficiary for quality and satisfaction, employer for affordability. In addition, our second strategic pillar, how can we make the relationship between payer and provider more productive? We know very well payer and provider, sometimes they would have love and hate relationship. However, we'd like really to help them from regulatory point of view to build a win-win situation, win for them and win for the beneficiaries. Also, we are working on building the infrastructure with our partner in the sector as a regulator, so we can we worked aggressively over the last year to roll out our coding standard across the nation, and we enhance it by CCHI billing system, so we have one language across the sector. I think this is a major milestone. I think it's a good opportunity to celebrate it and to thank whomever worked on this project, either our staff, stakeholder from the sector, our consultant companies. So it's really it's my pleasure to integrate again our CCHI billing system, which is based on our national coding standard, in addition to the requirement for the billing. In addition, we are building side to side the platform that will help to reinforce these coding standards. We know building a standard is an achievement. However, reinforcing it is more challenging. That's why we are lucky to have NFIS to help to reinforce adoption of the coding standard, which I'm sure will help the providers to see what they are doing, how they can improve their quality, what's their opportunities, what's their risk. And also it will help them to build a benchmark. In addition, we're working with our partner regulatory authority in the country to make the business is more attractive in terms of on the buyer side and the provider side. In addition, providing affordable premium to the employer. We know the private sector will be one of the key driver for our economy toward 2030. So we think of ourselves as CCHI to be an international leader in prevention and providing the best value and care for the beneficiaries of cooperative health insurance. Our mission, not anymore to provide treatment, it's really to improve the health of the people. That's the end result. We'd like to go to the outcome rather than to just be reactive. That's why we are now evolving our benefit package to include all preventative services. So our 5 strategic pillars, it's around beneficiaries, it's around enabling the sector, the buyer and provider. And the 3rd pillar is the value, which is really value-based healthcare. That's based its foundation on the capability of the provider and the buyer, and also the capability of our digital platform. That's why digital excellence is one of our strategic pillars. As a regulator, we look to ourselves as a facilitator. That's why we expand over the last year of our capability by hiring more talented people, reorganization structure to the whole organization with approval of board and support. In addition, also we have our partners to help us working through this journey. We came with 17 programs and 63 initiatives, and there is work in progress to measure the outcome of those projects, and we are accountable toward our stakeholder to get them accomplished as per timeline. Why we are adopting value-based healthcare? We know very well the cost of healthcare will continue to grow over the upcoming 10 years. Our initial assumptions with the National Program of Transformation for Health, our cost for healthcare will double or maybe triple over the upcoming 3 years for so many reasons. That's why the system will not be sustainable. That's why status quo is not an option for the public, neither for the private. So value-based is becoming a necessity to adopt. And as you can see, the value-based has been one of the leads of the concept of value-based around 5 pillars. How can we organize into integrated practice units where we really make sure we adopt the best primary care model? How can we measure outcomes? How can we move to bundle payments? Our aim over the upcoming 2 years to build DRG where we can build the foundation to move to the bundle payment, which will be inclusive of all category of care in one bundle. In addition, we'd like to make sure the movement of beneficiaries among providers from primary to tertiary is seamless, in addition of expanding center of excellence and reach out in terms of geographical distribution based on the data that we're going to gather, and we know our patients' needs, and this will help us to plan where should be having accredited provider. That will be definitely enabled by building the platform. Value is quality over plus services over cost, and that's the simple analogy. I will not go in details, but this concept evolved around so many domains by a lead organization around the world. How can we build DRG? That's the first step. How can we build bundle payment? That's the second step. And that's why we are really moving now from fee-for-service to a DRG, and then we can build the bundle payments. And this will not materialize unless we have a good data. That's why your event is a very much important to us, and we are obligated to support it to help to the sector to grow. This is just an example of how can we bundle payments. I'm sure this is a science that evolving, where we really aggregate the episode of care in one bundle under one diagnosis, so we can improve the continuity of care, reduce the waste, improve the quality and satisfaction, and reduce and maintain sustainability. So, and there is some people, they are still skeptical about value. There is a lot of live example around the world highlighting that there is a success story that we can mimic and can replicate. And I'm sure the momentum that we have in CHIME and the World Economic Forum and the G20 will help us to learn together internationally and move forward toward value-based healthcare together. I'll just jump to the most important part of the presentation. Really, this is an extensive effort that was done by the team in CCHI with their consultants, several companies of recognized performance, in addition international expertise from, some of them are actually from AHIMA. So we were committed as regulators to move forward and to adopt the Australian. However, there was a challenge regarding some of the missing standard due to change of payment scheme, private versus public. So we debated the three models that you see on the slide, and we came up with a project plan where we really customize some sort of the ambulatory coding standards to help us to streamline the language of exchange between buyer and provider based on our setup and based on certain review of cases on our field. And we came up with a coding standard plus billing system that cover all DRG, HE service code for inpatient, and also some codes that used for ambulatory care. The total number of codes, as you can see, is really 9,400. This is work in progress. As you can see, this is a live document around the world, and we are building the capability at CCHI to keep this agile and covering all the needs around the country. And definitely we'll learn from your conference a lot about those elements and the science behind it, and how can we evolve toward what the stakeholder need, in addition, not to miss the focus. And this is an enabler to help us to build the foundation for value-based healthcare. So these are the descriptions, and I'm sure some of the speech will detail these kind of classification. However, it was a very tedious journey, a lot of effort, thousands of hours, where the team and the consultant who worked with us, thanks to both of them and the stakeholder around the country, to produce our CCHI billing system. Definitely, one of the main pillars, how can we implement the CCHI billing? One is really defining the standard, mandating the law that has been happening. How can we make sure that the market will adopt? That's where the next slide will come.
نفيس هي المنصة الوطنية لخدمات تبادل المعلومات الصحية، مبادرة أطلقها مجلس الضمان الصحي التعاوني بالتعاون مع المجلس الصحي السعودي والمركز الوطني للمعلومات الصحية وبالشراكة مع وزارة الصحة. نطمح من خلال المنصة إلى تحويل منظومة الرعاية الصحية في المملكة العربية السعودية من خلال استخدام أحدث التقنيات لتعزيز مستوى وجودة الخدمات الصحية، وتوفير بيانات موحدة دقيقة ومكتملة تدعم تحقيق نظام المجموعة المتعلقة بالتشخيص DRG والرعاية الصحية القائمة على الجودة والكفاءة Value-Based Healthcare. وتحتوي المنصة على خدمات التأمين الصحي الرقمي الموحد، وتهدف الخدمة لعمل حلقة وصل تربط جميع مكونات النظام الصحي التأميني كشركات التأمين والمستشفيات والصيدليات وغيرها من المستفيدين بشبكة معلومات واحدة يسهل الوصول لها. الخدمات الصحية وأهمها الملف الصحي الموحد للمريض، بحيث يربط مقدمي الرعاية الصحية بالمملكة بنظام يسهل عمل الممارسين الصحيين ويعزز من الصحة العامة. تهدف منصة نفيس إلى تحسين الخدمات المقدمة للمستفيدين والجهات المعنية الأخرى عن طريق أتمتة وتحسين الإجراءات لتقليل الهدر التشغيلي وتعزيز جودة وكفاءة الخدمات المقدمة. حوكمة قطاع التأمين الصحي ورفع مستوى الالتزام بالسياسات واللوائح. توحيد اللغة والمعايير المستخدمة والتراميز الطبية في التعاملات الصحية والتأمينية وتوفير بيانات وفق منطق يدعم اتخاذ القرار. ولتحقيق تلك الأهداف تتبع منصة نفيس نمطاً محدداً في طريقة عملها، والتي تعتمد على عدة ركائز أساسية، وهي الربط، حيث أن كل الجهات المعنية والمستفيدة ستكون مترابطة عبر الشبكة الرقمية. الوصول المشترك، وذلك عن طريق وضع وتطبيق معايير وطنية لترميز الخدمات الطبية. القدرة، والتي تتمثل في إمكانية إدارة عدد كبير من التعاملات بسرعة والاستفادة من المستحدثات التكنولوجية، وأيضاً ممارسة العمل بكفاءة عالية. الحفاظ على الخصوصية والأمن السيبراني، وذلك بالحفاظ على سرية المعلومات على مختلف مستوياتها المسؤولية، بتوفير البيانات أولاً بأول وتحليلها لتحسين الإجراءات ومخرجات النظام التأميني الصحي. نفيس.
Thank you all for being patient. Thank you, Lester, for the good opportunity. Looking forward to continue partnership with AHIMA. Thank you.
Excellent. Thank you so much, Dr. Shabab. I was wondering if you just had the time to ask one quick question. Absolutely impressive presentation, very, very impressive transformation that you're going through, and numbers there that you've been presenting, not to mention the Nafis project as well. There's no doubt that the move towards a value-based care system will be a win for patients and providers who care for them. Can you talk just very briefly about your strategy in preparing the providers for these changes?
Lester, I think this is a loaded question. I think it's really a change that it is must to happen. We are lucky that we're under the umbrella of Vision 2030. The country is transforming, so that momentum is really the main driving force for the whole sectors, including health. So we are lucky to capitalize on this momentum toward the change. So that's one of our tools for change management. Two, I think engaging with the sector, either payer or provider, is a continuous from day one. We build around our strategy around the sector. They were the owner of it. We were the facilitator. Most of our strategic pillars, it comes actually from them. Even our board is really represented by the payer and the provider. So their first interest is really to make sure that we build the right strategy to help them. So that's the second level of engagement. Third level of engagement is really to provide a continuous support, either from regulatory and enablement part as the bylaws, the policies and procedure. And we created an independent department under our digital transformation business line to help the provider to be ready to adopt the changes, either from business point of view or from technical point of view. The fourth level of change management is really how can we have a very robust communication strategy geared toward the waves. If you have a big challenge, you slice it to waves. That's why even the onboarding of provider and payers on the platform are going in 2-3 waves. So every 6 months we are focusing on one wave, and that will help us really to give full attention to the waves. We understand their business challenges, their technology challenges, and we help them through the procedure. through the process, and then we move to the second wave. And we are optimistic in terms of insurance service under Nafis platform, we'll be able to accomplish within 12 to 18 months, inshallah.
Okay. Great. That was very helpful. Thank you so much for clarifying that. And thank you so much for being here with us today. It's a wonderful pleasure that you took the time for that. So can't thank you enough. We will now move on. Thank you. Yeah, so we are now going to move on to our next keynote speaker. And it's a great pleasure for me to be able to introduce my boss, the CEO of AHIMA, the American Health Information Management Association, Dr. Walisia Wiggs Harris. Dr. Harris has been hailed as an innovative leader with a vision for transformative growth, which she has proven as a leader of the world's largest HIM association, the leading voice for health information management, impacting 1 billion patient visits each year through health data integrity and best practices. Prior to AHIMA, Dr. Harris was CEO at the League of Women Voters. Dr. Harris holds a PhD in organizational development from Capella University in Minnesota and a Master of Management degree from Northwestern University in Illinois. She also holds a bachelor and an honorary Doctor of Humane Letters degree from Wittenberg University in Ohio. And she's also an ASAE certified executive director. From Chicago, please welcome the CEO of AHIMA, Dr. Harris.
Thank you for that wonderful introduction. And thank you to Dr. Shabab for your efforts to make this special gathering possible. My name is Wylecia Wiggs Harris, and I'm excited to connect with you digitally by way of my home in Chicago. I am the CEO of the American Health Information Management Association, or as we're often referred to, AHIMA. As advocates and educators in an ever-changing space, AHIMA is dedicated to providing health information professionals and their partners with the support and insights they need to continue leading the evolution of healthcare. AHIMA represents professionals who work with health data for more than 1 billion patient visits each year. And that data comes from every healthcare experience, every conversation, every knee tap, every blood draw generates essential health data that can significantly impact our personal and collective well-being. The responsible collection, protection, and analysis of health data allows practitioners to provide effective care, economic engines to innovate and run smoothly, researchers to make life-saving discoveries, and individuals to maintain good health. At AHIMA, we are the leading voice of health data, or as we call it in the US, health information. Using our deep understanding of health information, we lean into the future and forecast where healthcare will move next. We are particularly passionate about education and training. As advocates and educators in an ever-evolving space, we are dedicated to providing our professionals and their partners with the support and insights they need to continue leading the evolution of healthcare. And for health data to be as useful as possible, it must be easily integrated and shared between doctors, insurance providers, and other stakeholders. The COVID-19 pandemic has shown a spotlight on the importance of health information and health data. We have aimed to be nimble during this complex time. We've kept our focus on ordinary people and being a force for societal good. And speaking of being a force for good, I'm impressed with the Kingdom of Saudi Arabia's commitment to delivering excellent patient care to its citizens. It's been fascinating to learn about Vision 2030, and I was especially interested to read about the program's healthcare model for hospitals and insurance partners. I'm pleased we've been able to collaborate with so many organizations recently, especially on projects of interest to you. AHIMA has worked with Acumed this year to develop a new outpatient procedure coding classification system in the Kingdom of Saudi Arabia. AHIMA contributed to the project by auditing and analyzing the codes assigned to more than 50,000 outpatient claims from your citizens. Our analysis showed the need for more than 500 new medical codes, leading AHIMA and Acumed to develop the curriculum for the Saudi Outpatient Coder Certificate Program, so that Saudi coders can be trained on how to use these new codes. And Acumed and our Australian Health Information Management colleagues are working within the Saudi Arabian health model to create plans for higher quality health data and a workforce prepared to meet the health data challenges of the 21st century. It's also been terrific to work with the Saudi Health Information Management Association. We look forward to hosting events with you during Health Information Management Week in Saudi Arabia and strengthening our relationship with you in the years to come. And I'm pleased to share AHIMA is working with Health ISAC, a global nonprofit member-driven organization, healthcare stakeholders, a trusted community, and forum for coordinating, collaborating, and sharing vital physical and cyber threat intelligence and the best practices with each other. Cyber threats are, of course, a prominent concern shared by health systems in the US, Saudi Arabia, and across the world. As for the Operation Health meeting today, I'm pleased to be joined here by two leaders I know well. Joseph J. Pfeiffer of the Healthcare Financial Management Association and Russ Branzell of the College of Healthcare Information Executives. I'm looking forward to Joe's session in which he will discuss how the Healthcare Financial Management Association oversees revenue cycle management standards here in the US. Thank you again for attending Operation Health today. I read that estimates indicate the Kingdom of Saudi Arabia will need 10,000 medical coders to work in the industry in the coming years. And I hope we are at the beginning of a collaboration between AHIMA and Saudi Arabia that will improve healthcare in the kingdom and across the world. AHIMA is so impressed with Saudi Arabia's healthcare transformation and are honored to have the opportunity to contribute to its success. It's terrific to be in the company of peers who understand that health data is human data. Thank you.
And we're now ready to move on to our second speaker from the United States, Mr. Russ Branzell, who's the CEO and president of the College of Healthcare Information Executives, which is also known as CHIME, and its affiliate associations. In addition to CHIME, Mr. Branzell also serves on the faculty of Columbia University, where he teaches executive classes in health information technology. He is a member of the Baldrige Foundation Board and a former member of the Board of Overseers of the Malcolm Baldrige National Quality Award, a position that was appointed by the Secretary of Commerce of the United States. Prior to joining CHIME, Mr. Branzell served in numerous administration positions for several different healthcare organizations, including the Air Mobility Command Surgeon General's Office while serving in the US Air Force. I'm happy to introduce now Mr. Russ Branzell from CHIME.
Russ Branzell, CEO and President of CHIME. It is an absolute pleasure to be part of the Operation Health program for the Kingdom of Saudi Arabia. It's my pleasure to present to you today some of the results from our Digital Health Most Wired program, one of the world's largest benchmark and surveying process for digital health and IT adoption and outcome utilization. We'll go over a little bit about the program and some of the results we're seeing, and then hopefully at the end, an open invitation to participate in the program. So let's just get started. We've been running this program for about 3 years, but in collaboration and then prior with another organization, the program's been around for over 2 decades. So it makes it one of the longest tenured programs for benchmarking and surveying for overall clinical adoption, or in most cases, organizational adoption of digital health and information technology programs. But more importantly, we want to make sure we're identifying, recognizing, and certifying the adoption of those, the implementation of those solutions, as well as the outcomes that come with that. Technology for technology's sake is important sometimes, but more importantly, we want to make sure we're making a difference for our patient safety and the outcomes in our organizations, regions, and countries. And that's exactly what we've done with this program. So what has happened during that period of time is some industry experts across the globe have come together to really rebuild this from the ground up. A continuous process of raising the bar and holding ourselves accountable to the best we can do for healthcare and healthcare adoption of digital health solutions. In 2018, there were about 2,500 organizations, though that's a good number, relatively small when you consider how many different facilities are around the globe. What we've seen, though, is significant growth. In 2019, over 15,000 facilities globally participated in the survey. It gives us one of the largest data sets. What has happened in 20, even during this difficult time of a pandemic globally, we've seen the number almost double again. Over 30,000 facilities globally have participated in the program, which now gives us, if not the largest, one of the largest historic data sets, benchmarking and surveying results program across the entire globe. We're glad to share some of those results with you today and some of the outcomes we've seen. As I mentioned, it's a continuous process to raise the bar. So even if you maintained your performance from last year, if we raise the bar, you may actually start falling behind. Our goal, again, is to get really good organizations to focus on continual improvement. We're pleased to announce that this year in the 2020 survey process, 8 organizations achieved our highest level of performance, which is level 10 certification. These organizations are 100% dedicated to improving patient care, outcomes, safety, and in many cases, trying to reduce the burden of cost for people and improve access, all through the use of digital health solutions and information technology opportunities. These organizations have done an amazing job. The number last year was 3, and those 3 still maintain their status as level 10, and we've added 5 additional to the program. Now, for your country in particular and for your peers, we are excited to announce that there are 2 organizations in the Kingdom of Saudi Arabia that have been recognized and certified as Digital Health Most Wired. First, we have the King Faisal Specialist Hospital and Research Center. They've been recognized in their first year participating in the program as level 7 certified, with the special recognition that goes with that. Now, even more exciting, in only their 2nd year ever participating in the program, the International Medical Center has been recognized and certified as a level 9 organization. That makes International Medical Center the highest certified international outside the United States organization on the planet. So congratulations to both these great organizations. I know a lot of work and dedication from everyone there, not just the IT staff. An entire organization has to be dedicated to digital health outcomes for their patients and who they serve to receive this level of recognition. It is not easy, to say the least. So what does it mean to be certified at a specific level? What we have done is we built a banding system that, based on percentages and range scores in every criteria across the entire survey, what we're able to do is certify those results. Now, we don't just do that from the results being turned in. Those survey results are validated by some officials, part of our governance structure, that validate everyone from level 7 higher to make sure that their recognition is well-deserved and validated. That is a new addition to the program over the last 3 years. And the level 10s I mentioned earlier, actually in normal times would have to get an on-site visit to validate the results live. But during these COVID period of times, they did a full virtual visit for that. So as you can see, we'll progress up this bands. But to stay a level 10, as I mentioned before, you would have to continue to improve. You could actually lose some pace if you didn't keep up with the standards and the requirements of the program as you move forward. Now, as you can see, in our level 10 organizations, a vast majority of them improved year over year. Matter of fact, all of them at least maintained the results and continue to move forward, some significantly. If you look at organizations like Organization E, they went from around 82% compliance with the standards that are in there in the survey, up to almost 95%, 94%. That's a huge jump. Matter of fact, overall, all the level 10 organizations actually improved by a combined average of 5.1%, a significant improvement year over year. Again, remember, that's a 5.1% improvement while we're continuing to raise the bar every single year. Now, amazing news for our friends at International Medical Center. Your results are even more impressive. And this is one of the best results we've ever seen. And these have been validated. In 2019, you were right around 53%. What we saw was just over 80% in 1 year. This is a focused digital attention on digital health and information technology and all the outcomes that go with it. Again, one of the greatest improvements we've seen year over year. So great credit and congratulations to the folks at International Medical Center. Now, if you can do it, all your peers can do it as well. And that's one of the things we want to focus on is outcomes that continue to improve for all organizations. Here's some of the highlights, just a few, and you can have access now to the full trends report that'll be available. We'll give you the link to that. It's free to everyone to go ahead and see. But here's what's really amazing, and we all know this, part of this was related to COVID, but if you look, telehealth adoption was starting to move up, not huge numbers, but if you look from 2018 to 2019, patient homes went up almost 50%, almost 25% for physician offices. Again, a smaller number for hospitals, but then you see the huge jump in 2020. We anxiously look forward to see our 2021 to see where it's leveled off. Our belief is not just because of COVID, but for use of digital health to improve accessibility to patients, we will see these numbers continue to improve and stay at high numbers. Maybe not as high as the peaks, but we'll continue to see them improve. One of the things we really wanted to focus on is the ability to deliver value with the amount of money and access we're providing to patients and to the communities. And if you look at this graph, what's really exciting for us is in every single category, no matter what category it is, what type of payment system it is, doesn't matter, every single category year over year improved. We saw significant improvements. Matter of fact, if you look at the bottom, the only area that didn't improve is the area where we're not giving any value there, which is actually a good number to see go down. So we continue to look in optimism that we're continuing to provide better and better value for our patients, for those we serve, and the communities that we serve across the board. Now, one of the things that we've tried to focus on even more intently is the ability to engage both patients and clinicians in that really joint effort of population health. Now, in our survey process, and I'll highlight two areas in particular down here, patient engagement and clinician engagement. One of the things we want to do is figure out how to improve the engagement for both. Because if both those that are giving the care and receiving the care really are engaging in a better way, we believe that clinical quality will improve, safety, costs will improve, and overall the experience will improve for all. And as you can see from this graph, in every single area, once again, both patient engagement and clinician engagement improved from 2019 to 2020 across the board. What we're seeing is there's a focused attention across all those completing the survey to focus on really engaging at a consumer level, a patient and clinician level, to really improve the overall clinical outcomes. Matter of fact, if you look at this, just using portals that are generally acceptable and available inside electronic medical records and other solutions, we saw these numbers massively jump, where over 25 were receiving their primary patient engagement through this. And I'm sorry, 75% of their of participants were receiving 25% or more of their not just care but engagement through a patient portal. Just a few years ago, that was like 1%. So we've seen it go from 1% to almost 75%. Yes, maybe a small bit COVID induced, but what we're really seeing here is that the opportunity to engage patients where they are in their digital world, their digital identity, has now officially become real. That's an amazing statistic. Now, as we look here again at patient engagement, and I won't go through all these specifics, glad to let you look at this in our overall trends report. But again, with the exception of no mobile app and no mobile capability, every single area year over year improves. Some of those unbelievably high. E-visits, virtual visits, massive increases on these things. Across the board, just about every single area increased significantly, both in capability offered and capability utilized as part of our survey results. So again, if you're not focusing on these things, it's not that you're staying where you are, you're falling way behind the competition, you're falling way behind your peers in the ability to really provide better care and better support for your patients and those that are seeking care in your organizations. Now, one of the things we want to make sure is that we're also focusing on clinical outcomes, clinical engagements, and clinical capabilities. In this area right here, one of the things that I really like about this is, yes, we saw a market increase from 2019 and 20 in the ability of clinicians to actually provide and perform areas remotely, also to be able to get clinical alerts remotely, but it was not a new phenomenon because of COVID. If you look at the trend lines for all four areas, the trend line stayed consistent year over year. Now, based on these trend lines, and if those continue into next year, what you're going to see is people are going to be able to engage in the way that their normal lives are now, their digital lives engaged, whether that's email and all the other kinds of things they do on a mobile device and a mobile environment. It's just going to become second nature, and to be able to provide the providers what they need. They won't be tied to a hard computer or a hard office in a leather location. They'll be able to be mobile and do the things they want to do in their lives. Again, satisfaction along with better outcomes. One of the areas we really focus on is cybersecurity. So across the globe, doesn't matter what country it is, everyone's focused on cybersecurity. Again, you can see that results continue to improve across the board. But what we do see is that there is a difference between organizations that truly focus on a comprehensive security program and those that don't. Results are markedly different. And this does not have to do just with size of organization, complexity of organization, or the financial wherewithal of that organization. We see small organizations with comprehensive security programs, and we see large organizations without a comprehensive security program. What we are seeing, though, is it really becomes the haves and have-nots, that those that focus on cybersecurity provide a better, more stable, private, and secure location for care to be delivered in a digital world. We'll continue to focus on this and highlight those areas where there are really exceptions that are there. This was just a brief look at a few areas for you in the survey. Again, I would encourage you to download the survey. It is available for you out there, or contact any of our program experts for the Most Wired program. There's an email you can go to, which is mostwired@chimecentral.org. But if you go out to our Most Wired site with the URL that is on there, you can download copies of our national trends reports and our top performers and see some of the benchmark data is there. Again, free for you and free for your organization. Having visited your wonderful country and spent many times with some of the great leaders for digital health and IT there, and along with just the rest of your leaders there, I know you're committed to great clinical quality, great providing of service for the people of your country. We would love to invite you, an open invitation to be part of our 2021 Digital Health Most Wired survey that will be coming out right after the new year. And so to join, hopefully, your two other organizations that have done so well. Again, great congratulations to them. But we're not going to stop at CHIME. CHIME, we're going to continue to raise the bar across the entire spectrum. Our goal is to make sure we're doing everything we can to deliver the best possible care, the safest possible care at the most reasonable price possible. And we will do that by sharing with each other, participating in open surveying processes and best practice sharing. For now, thank you so much for all you do for the great people of your country, and we thank you for being part of this program. Take care.